Alright, let's dive into something that's been making headlines recently, and it's a real head-scratcher. Robert F. Kennedy Jr., the U.S. Health Secretary, has been urging parents to vaccinate their kids against measles. Sounds like a no-brainer, right? But here's the twist: this is the same guy who's spent years as a leading voice in the anti-vaccine movement. Personally, I think this is one of those moments where you just have to pause and ask, what's really going on here? Is this a genuine change of heart, or is there something else at play? First off, let's talk about the measles outbreak. The numbers are staggering: over 2,300 cases this year alone, the highest in 35 years. If you take a step back and think about it, this isn't just a health crisis, it's a symptom of a much bigger issue. The anti-vaccine movement has been gaining traction, and now we're seeing the consequences. What many people don't realize is that measles isn't just a childhood illness, it can be deadly, especially for those with weakened immune systems. So, when Kennedy says parents should vaccinate their kids, it's not just about preventing a rash and a fever, it's about saving lives. But here's where it gets really interesting. Kennedy has been a vocal critic of vaccines for years, spreading misinformation about the MMR vaccine, among others. So, when he suddenly starts advocating for measles vaccination, it raises a deeper question: is this a strategic move to save face, or is he genuinely rethinking his stance? In my opinion, the timing is too convenient. The outbreak is out of control, and the US is at risk of losing its measles elimination status. It feels like he's trying to cover his tracks, but the damage is already done. What makes this really fascinating is the contrast between his words and his actions. During the CNN interview, he was combative, dismissive, and even condescending. He accused the host, Dana Bash, of not understanding science, ironic, considering his own track record of ignoring scientific consensus. One thing that immediately stands out is his refusal to take responsibility for the surge in cases. Instead, he blames religious communities and global health conditions. From my perspective, this is classic deflection. It's easier to point fingers than to admit you've been wrong. Now, let's talk about the broader implications. The rise in measles cases isn't just a US problem, it's a global trend. And it's not happening in a vacuum. The anti-vaccine movement has been fueled by misinformation, fear, and a growing distrust of institutions. What this really suggests is that we're dealing with a crisis of communication. How do we rebuild trust in science and public health? Personally, I think it starts with accountability. Figures like Kennedy need to acknowledge their role in spreading misinformation and actively work to correct it. But here's the kicker: even if Kennedy is now advocating for measles vaccination, he's still spreading misinformation about other health issues. During the same interview, he made unfounded claims about RSV, Lyme disease, and Tylenol. This raises another question: can we trust anything he says? In my opinion, his credibility is shot. It's like he's trying to have it both ways, appearing to support vaccines when it's politically expedient, while still sowing doubt elsewhere. So, where does this leave us? The measles outbreak is a wake-up call, but it's also an opportunity. It forces us to confront the consequences of misinformation and the importance of science-based decision-making. What many people don't realize is that vaccines are one of the greatest achievements of modern medicine. They've saved millions of lives, and yet, here we are, debating their safety and efficacy in 2026. It's baffling. As I wrap this up, I'm left with a thought-provoking question: can someone like Kennedy truly change? Or is this just a tactical shift in response to a crisis? Personally, I'm skeptical. Actions speak louder than words, and his actions over the years have contributed to this mess. But maybe, just maybe, this is the first step toward a broader reckoning. What do you think? Is Kennedy's call for vaccination a genuine turnaround, or is it too little, too late? Let me know in the comments below.